Now, here we get to the part where we explain why is 5-HT2A receptor antagonism important for a decrease in EPS and hyperprolactinemia. Okay, a decrease in EPS and also less prolactin elevation. Okay, very important to keep this in mind. This very basic spectrum here. When you talk about, first of all, going back to dopamine. Yeah, we want 60% of D2 receptors blocked for therapeutic efficacy. If we go too much blockade over here, on this side here, you end up blocking the D2 receptors that are too much, particularly those that are involved in motor control. That's where you end up with EPS, Parkinson's, that side of the spectrum. But not enough blockade, that's where psychosis comes in. So you kind of want like a Goldilocks scenario where just 60% is blocked. But at the therapeutic dose, they tend to kind of go off overboard. So where does 5-HT2A come into play here? 5-HT2A can kind of bring down the excess blockade, particularly in the nigrostriatal pathway. You remember, in schizophrenia, the nigrostriatal pathway is kind of, generally it's fine. There's nothing troubling it. When you introduce an antipsychotic, yes, you want to block the D2 receptors in the mesolimbic pathway, but you inadvertently block too much in the nigrostriatal pathway. So I kind of just want mesolimbic D2 receptors blocked. 5-HT2A can help with that by indirectly reducing the amount of blockade in the nigrostriatal pathway. How does it do that? It's kind of not shown here. I just wanted to keep it visual because there's really a whole wall of text behind this, and I don't want to go through that whole wall of text. So instead, I'll show it's kind of a shortcut, but there's a long winding path here when you look at this serotonin neuron. So there are 5-HT2A receptors. And many, again, it's spread out over the brain. One of the parts of the brain where you see 5-HT2A receptors connects to dopamine in a very long, winded, convoluted path, actually. This is a shortcut version. The long-cut version, in short, serotonin, normally, when serotonin binds to the 5-HT2A receptor, normally, this would lead to an increase of glutamate. So there's kind of a long-winded pathway here. Increase in glutamate, so as in betchin, MSG, monosodium glutamate, right? That glutamate being a stimulatory neurotransmitter, glutamate will then stimulate the release of GABA. Okay. GABA, this time, as in think of GABA like GABA. GABA being inhibitory because during the gabi, at nighttime, the Tagalog, you are, resting, so inhibited. So think of GABA as the inhibitory neurotransmitter. So again, serotonin at the 5-HT2A receptors leads to an increase of glutamate. Glutamate being stimulatory, stimulates release of GABA. GABA being inhibitory, GABA will then inhibit what? Inhibit release of dopamine in the striatum, in the nigrostriatal pathway. But wait, don't we want to do that for schizophrenia? Yes, in the mesolimbic pathway. But remember, we are in the nigrostriatal pathway. In the nigrostriatal pathway, we want dopamine to be doing its job. However, there is too much blockade in a pathway we don't want blocked. So how does this long-winded blah 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 from serotonin to 2A receptors to glutamate to GABA to dopamine help with that? Okay? When we antagonize. So that was, I explained earlier, that was the normal functioning. So normally, serotonin binding to 2A receptors, so you get glutamate, more GABA, less dopamine. But, remember, second gen, third gen antipsychotics, they are 5-HT2A receptor antagonists. Meaning, just flip that opposite. So 5-HT2A antagonism means less glutamate. Less glutamate, less GABA. Less GABA, so less inhibition, just means more. It's kind of negative is positive. More dopamine release from in the nigrostriatal pathway. And how is that beneficial? More dopamine release can displace the D2 antagonists in the nigrostriatal pathway. So, you see here, because the antagonism here is kind of just competitive. So, you increase endogenous agonist dopamine. Enough dopamine can displace the D2 receptor antagonism here, could bring down the blockade from 80% to about 60%. You don't need to get rid of them fully from the nigrostriatal pathway, because you might end up getting rid of the antagonist and the mesolimbic as well. Because again, you can't really control that. So just kind of bringing down the blockade from 80 to 60%, that's good enough. So that means the D2 receptors in the nigrostriatal pathway, less of them are blocked now. Less of them are blocked, and your motor function can normalize. So that is why 5-HT2A receptor antagonism is important for a decreased incidence of EPS. I'm not saying it's absent, because there are still people, even on the so-called antipsychotics with the lowest incidences of EPS, that may report EPS. So it's still possible. So the rate can vary, but overall, the rates will be less than that of first gen. And of course, it's not uniform. So like I said, risperidone, paliperidone, they are the exceptions, because again, their D2 receptor antagonism is super potent, and its potency is very close to that of its 5-HT2A receptor antagonism, such that once you hit a therapeutic dose, possibly not enough 5-HT2A receptors are blocked, so maybe not enough dopamine is displacing the drug from the nigrostriatal D2 receptors. Probably not enough. So you see higher rates of EPS in risperidone, paliperidone. In fact, the companies behind this, they actually tried to hide that. But the US FDA was not having it. They were like, I smell your and they're they were called out for it. They were fined for it. Thankfully, the truth came out eventually that yes, risperidone, paliperidone, even at the so-called low doses, they do have a lot of EPS and high prolactin elevation as well. Okay, so again, please study this as individual drugs, or else you're going to have a difficult time, really. Okay, so in meme format, in true typical meme format, this is just the summary. So normally, when serotonin again binds to the 2A receptors in the pyramidal neurons, that will lead to release of glutamate. Glutamate stimulates GABA release from the brainstem. GABA blocks dopamine release from the striatum. Normally. But then, when you have those receptors antagonized, the whole thing just reverses. So, no glutamate means no GABA. No GABA means dopamine is released freely to displace, again, the excess D2 antagonism in the nigrostriatal pathway. So, less EPS. Okay, that's just for EPS. What about prolactin? Thankfully, prolactin is a bit more direct. So again, you go back to what we talked about, how dopamine and serotonin have reciprocal functions in the anterior pituitary. Go back to that, and then flip it around. Again, we're talking about antagonists, right? So D2 antagonists, they would promote prolactin release. That's why you have a lot of hyperprolactinemia with first gen antipsychotics, so-called antipsychotics in general. If it's second gen, again, except for risperidone, paliperidone, because you antagonize 5-HT2A receptors, you antagonize those, you can counteract the prolactin releasing effects of the D2 antagonism by blocking 5-HT2A receptors, because again, their functions are opposite. So, depends on you what you want to memorize. If you want to memorize D2 and 5-HT2A receptor antagonism, that's fine. Or actually, you know what? You can just memorize one, because technically, their functions are opposite. So, I memorize dopamine's function. Dopamine would block prolactin release. Okay, memorize that. Then I know serotonin's function at the 2A receptors is opposite. As an agonist, it would promote prolactin release. Now, what would happen if I block those receptors? Then I just flip them. Okay, so that's how you can remember better. Okay. So again, with the exception of risperidone, paliperidone, and actually amisulpride. So this should be in the slides. It's not here. So risperidone, paliperidone, and amisulpride. There should be one more here. So risperidone, paliperidone, amisulpride, they have higher rates of EPS and hyperprolactinemia because their D2 receptor antagonism is just too potent. But otherwise, the others will have less. To varying degrees, they will have less.